algorithms and methods that perform tasks that were thought to require human intelligence. I think it's still quite a difficult term. Moreover, there's quite some discussion because, if you would look for other explainers or definitions, then you will see that everyone uses different definitions. So there's not really one single definition, and there's also some discussion about the fact that AI, artificial intelligence, whether this is really a happily chosen term. Also, it's good to know that AI is a scientific discipline that already exists for quite a long time, since the 50s. What we do know is that it is about analyzing large amount of data by computers. But if this is really intelligent, so there's a lot of discussion on that. And I think a lot of you will know Lieven Scherer. I think he is really good in explaining scientific concepts in a, accessible way. He has also written a book on AI, and also he is hosting a show. I went to the show in Groningen, he was there, and I can really recommend it. I think he's doing a really good job in explaining also to a lay audience what AI is. But what we know for sure is that without data, there is no AI. So AI is really about processing of data by computers. And why they chose to use the term AI, so artificial intelligence, is that because they wanted to refer to the way people process data with a neural network. When you look at AI, then you see that there are basically two types or two ways in which computers can process data. First of all, by programming rules or instructions so that you program the algorithm. That's also been known as knowledge-driven or rule-based AI. That's been done for quite a long time. But also you can let the computer develop the algorithm. And then you're talking about data-driven AI or machine learning. And usually nowadays, when one refers to AI, often one refers to this technique of machine learning. And it's important to understand that with this new technique of machine learning, the algorithm is not programmed, but the algorithm is trained by people. And then it's good to know that there is a difference between machine learning and deep learning. So with machine learning, computers develop the algorithms by learning from a large amount of training data. And this resembles a little bit the way the human brain works. So by developing a neural network, and here you see a little bit of a picture. So you provide some inputs, and then the model will develop a network, and then in the end, the idea is that the model will train whether it is capable of processing in a correct way the input. So, for example, cars, you give them a lot of pictures of this is a car, and that is not a car, and then in the end, the program or the algorithm would look at different features or elements which are elements of a car, and it will be able to distinguish between cars or not cars. With deep learning, it basically works a little bit the same way. So it's like a family of machine learning, but the neural network is just much more complicated. And because it's a much more complicated neural network, you also need more data to come up with a good model. But what this form of AI does, it tries to find patterns in a data, and it can make predictions based on these patterns. Then finally, you have generative AI. That's also a form of AI which is based on a technique of neural networks. But in this case, the learned patterns are being used to generate new content or information, for example, text or images like ChatGPT does. And it's important to understand that what generative AI does, that it predicts word for word what the most probable next word is. So the data that is being generated, so a text or image, is not based on a certain form of knowledge. It's just based on chances. And it was difficult to find a good picture. So this is a picture of a screenshot of a Dutch news show, which is quite popular in the Netherlands. And here also a lot of scientific elements are being explained to the lay audience, and also some political discussions. And here you see that it's said, sorry, it's in Dutch, but it says, I am sitting on a. And then it could be a chair, a football club, a swing, a lot of different things. But basically what is being done with these generative AI models, a lot of text or images are being put into the model. And of course you see a lot of commonalities in there, or a lot of patterns. So very often there is, of course, a pattern in certain sentences that we use, that certain words follow on other words. And that's basically what is being repeated in these generative AI models. And the more text and images they have, the better they will be in repeating certain patterns. But of course, it can be wrong because it's just based on chances. So that's really good to know. And it's also important to know that this technology needs even more data than deep learning. So that's with regard to the definition of AI. What we also know is that AI is developing very fast and with high expectations. You see here a few pictures. On the left-hand side, there is a picture which is quite used very often. Here you see that ChatGPT reached 1 million users in just a few days, which was really exceptional. And you also see that there is really an increase in investment in AI. In the Netherlands, 2 years ago, the Dutch Scientific Advisory Board of our government launched a new report, which is called Mission AI, and they say that AI is the new systems technology. So they are comparing it to technology like energy and computers. So which technology that's really going to influence society as a whole. And why is this AI developing now so fast? Because as I told you, already since the 50s, this scientific discipline exists. Well, there are two reasons. First of all, there's an increase in data because of the internet. And second of all, we now have the computing power in order to be able to really process the large amounts of data. And this is not going to stop. Scientists predict that in 2027, over 90% of the online content will be fully or partially based on AI. So this is really a technology that is expected to grow the coming years. Then the focus of my talk will be on responsible development and implementation of AI. And what is that exactly? This year, a global index on responsible AI has come out, and you see here in this picture that they have used a lot of different areas to measure responsible AI. So that's the problematic part, maybe a little bit. It's quite complicated. So here they used 3 different dimensions, which is responsible AI governance, human rights in AI, and responsible AI capacities. And they have 19 different thematic areas. So you see there are quite a lot of elements that play a role when you're thinking about responsible development and implementation of good AI. The good thing is that when you look at the ranking and score, that both the Netherlands and Belgium are on the first page. So the Netherlands scores first, and Belgium 24th of, I think there were about 180 or 150 scored in this global ranking. It's good to say that this is based on this really large set of different aspects, and it was based on a self-assessment. So maybe we were a little bit more positive, but of course, we need to have some backup, and it just shows that Netherlands is in a good position to do this. They have thought about a lot of different things, but we also feel now that we have the responsibility to really keep to this first position and make really the things that have been set up happen, and that we really are going to develop and implement AI in a responsible way. Because it's not possible in the half hour I have to go through all the 19 different thematic areas, what I would like to do is to give you 3 takeaways. when I'm talking about responsible development and implementation of AI, I usually say there are 3 important things to keep in mind. First of all, it's important to be aware of the societal impact that this new technology has, and that it goes together with responsibility to stimulate responsible use of AI. That's also a little bit the 3 different key areas that was used in the global index. So governance, human rights, and AI capacities. It's furthermore important not only to pay attention to opportunities, but also to risks and challenges of AI. And finally, it's important to develop norms and principles for responsible use, but also to integrate these norms and principles in AI design and implementation. I just talked a little bit about the societal impact of AI and the responsibility that goes together with it. So now I will continue with the opportunities and risks and challenges. With chances, I just took a few examples of healthcare in which I'm working on, and these are all examples that we are also working at the University Medical Center, just to give you some ideas, because the chances are really huge. On the left top, you see movements. What is done more and more over is that you use the recognition tools, algorithms to check movements. In this case, this is on movements for development disorders. You can see that already in how babies move. In the top, in the middle there, you see also this facial recognition that's also used to diagnose genetic disorders, developmental disorders. On the right-hand side at the top, you see a screenshot of a movie that was made for an AI tool that's being developed at the UMCG to detect lung cancer. So they then look at images and see whether certain nodules can be classified as pathogenic or not. And on the left-hand side below, you see a report of the Ada Lovelace Institute. They do a lot of great research also on AI and also in the context of genetics. So this is a report on what the use of AI could mean in this field of genetics and genomics. In the middle, you see at the bottom, you see an example of one of my colleagues, Job Doornberg, and he is an orthopedian, and one of the models he's working on is the detection of the stability of a certain fracture, because depending on the stability of the fracture, a different treatment is recommended, and also AI could help in that. And finally, the right-hand side at the bottom, you see an example of the use of ChatGPT, so generative AI models that we use in our electronic patient records, for example, to generate concept answers to patients' questions they file in emails at our electronic patient file environment. So we're working together with our electronic patient file, how do you say that in English, the leverancier, so the one that's Epic, and a lot of different features are being developed there because it's a really big American company, and we are now implementing different features of this generative AI models in our hospital. So there are a lot of chances, but there also are a lot of risks and challenges. Here you see a picture of a database which covers more than 700 risks, which was released a few months ago. So I won't have time to go over all of these 700 risks, but just to give you a little bit of a snapshot, there are risks in a lot of different domains, and there are a lot of risks with regard to this ethical, social, and legal issues. So over-reliance, inappropriate use, transparency, privacy, trust, liabilities, unequal treatment of different people, sustainability. So a lot of different things that need to be addressed. I won't have time to go over all of them, but I would like to shortly touch upon 3 risks and challenges of AI, which are also important risks and challenges in the context of healthcare. So that's dependability, bias, and transparency. First of all, with regard to dependability, what you first of all see is there is humanification of AI going on. You see a lot of dystopic views and warnings about AI, especially in a lot of science fiction films. There you see that AI is being depicted as robots, which is smarter and stronger than mankind. And often they are also dangerous, making mankind dependable, or with the exterminator even trying to exterminate mankind. And these are science fiction films. And of course, science fiction is not true. So it's not a realistic depiction of reality. And you can say, to what extent is that a problem? Well, it is a problem if that causes a lot of fear and anxiety. And this report from the Dutch Scientific Advisory Board, they also say that it's important to demystify these wrong beliefs so that people know what is AI and what is it not. So that's one of the dependabilities, that we become dependent on wrong assumptions. And the second one is the big five. So in the future, when people talk about big five, it will not so much be the animals, but more the big five tech companies. And you see that they are really having more and more data about us. That's really the price that we pay for the free services. And I'm a big fan of Yuval Harari, and one of his books, he also writes that the countries and companies that control the most data will in the future be the ones that control the world. Or what some people say, data is the new oil. So it's really about the data that is being used and that's being owned by these companies. So there's really a lock-in also by using these and being dependent on these companies, which is a problem. ChatGPT, I think you probably all know about the existence of this generative AI model. The question is this really the revolution of the century? As I showed you, in just a few days, this company had a few million users. But it's important to realize that these big, large language models, they cost really a fortune to develop and also to maintain. It had cost billions and billions of dollars, which is only possible for the really big tech companies. Also, it's important to realize that they have taken data from the internet without asking for permission, and that they also do not offer the possibility to check if these models use personal information from you or to remove personal contact. And that's just a requirement in the European GDPR, so the AI protection law. Also, what you see is that since the launch of the new model, OpenAI is not transparent anymore about its architecture and training methods. And also there's a lot of discussion on how the model was trained. Because as I told you, you need to train a model, and that has to be done by people. And they used a lot of low-skilled foreign laborers to do that. They had to look at very disturbing content to train the model and to also leave out and make sure that the model doesn't repeat all this disturbing content, because then it wouldn't have been such a successful model as it is now. And also the environmental footprint of these models are huge. So this is a picture of the use of water. So Microsoft, which is now also one of the owners of ChatGPT, they use more and more water, but also energy is used, and of course also the metals to be able to make the hardware for these models. Also, what I think is very interesting is that we have this principle of data minimalization in healthcare, while the data hunger, you could say, of these large language models is really opposite to this principle. Finally, it's good to know that currently it's not just ChatGPT, but there's no large language model which complies to the AI Act. And that's also something that for the future, so now the EU AI Act is in place. In a few years, really everyone has to comply with this AI Act, then these models are not allowed to be used anymore. And you see also that currently, of course, all these companies, they try to comply now with the AI Act, and they are in the process of changing, and that is really needed. The Netherlands is also trying to make his own model, also to become a little bit more independent from the tech companies. They have received funding for 14 million euro, which is, you could say really, almost pennies if you compare it to the big tech companies. But what you see also is that maybe if you focus a little bit and don't really make this really large generative AI models that could do almost anything, but really develop a language model that is really being used in a certain context for certain questions, then also smaller models could be developed and work also for the solution or the questions you want them to work for. Then finally, with regard to the problem of dependability, what you see is a process of de-skilling at place. And that is, of course, something which is not really only happening with AI technology, but with a lot of different technologies. I think we all know that the loss of accounting skills. Now we have the calculators on our phone. And also I think we all recognize examples with navigation systems where navigation says that we have to go straight, but then we ourselves think, oh no, shouldn't we go right? And you see a lot of different accidents that have happened, that people drive into the water, into the metro, almost everywhere. So it's really a big problem. So de-skilling has a lot of different consequences, both on societal level and also on individual level, where you see that tasks are being taken over and there is also an over-reliance on technology. So that's also a problem with AI. Then the second risk is that of bias of AI, and that can be done in 3 different ways. I will go through them very quickly for the sake of the time. And the first is the social bias. So what you see is that we have a lot of social biases in our society already. And an interesting example is that of Amazon, who wanted to use AI to recruit top talents, but they did train the model with CVs submitted to the company over the last 10 years. And they were mostly from men, because it's a male-dominated company or even industry, you could say. And therefore also the AI started to prefer men over women. So what you see, if you don't counter the existing social biases, they will creep into your data set and they will also be biased algorithms. And that's just something you have to really be cautious about. Another thing is the representativity of the data set. What we know, for example, there are also really nice examples. This series on Netflix, Coded Bias, is really an interesting example of a facial recognition tool, which was trained based on people with white skin, and therefore it was a good model that performed well in recognizing people with white skin, but not with black skin. And this is also a challenge in healthcare, because we know that the data there is not representative for all groups. We know that research in health is mostly based on data of the male body, that there is also less data available from ethnic and low socioeconomic status group. And that it means that if you don't take care of this, then the performance of the AI will probably be better for the groups who are represented well, and worse for the groups who are not represented well. And if you Google, for example, and you Google for professor, then you see here it's usually depicted by pictures of white men. So this is what already is the data that is available, and this data goes into the current models like ChatGPT. And therefore the current models, they are not representative, and therefore they also don't work well. And a nice example, I think, is, sorry, it's in Dutch, it's from a Dutch magazine, but it was from Gemini, also an AI large language model. And there was a lot of discussion on the fact that it was not representative enough, and they tried to change that. And what happened then is that the model then came up with black Nazis, which is of course, not a possibility. But here again, you see that these models, they are not able to take the context into generation. And they try to address representativity, but you really need people and human input to really make these models work. And that's the final thing with regard to data. That's the access to data. So as I said, you really need a lot of data. You see here the CAPTCHAs. So the big tech companies, they let us do the CAPTCHAs. So that means that in doing this, we are really training their models. So they can easily develop and recruit a lot of data. Of course, in healthcare, that's not so easy. It requires protection of personalized information. And the consideration of context, as I mentioned, is really important and really difficult also for these models. To give an example, this is an image of a model that needs to detect a tiger. And here the model says, yeah, it's a tiger. But if you look closely at the context, then you will see, no, it's not a tiger. It's a dog, which has stripes from the fence. So the context really is very important. And I think this part from the program of Lieven Scherer is really nice. Also, you can find it on online. And here he explains what went wrong when training a model to detect between a wolf and a husky. The model performed very well. Well, suddenly there was one picture, and then the model said it's 100% a husky. Well, in fact, it was a wolf. And then it turned out that all the pictures that were put into the model were from huskies with a snow on the background, and the wolves didn't. So in the end, what does the model do? It didn't look at certain patterns or difference between a wolf and a husky. It just only looked whether there was snow at the background or not. So that's really important to understand that this context is important, and that these models, they just look at certain patterns, and it might not be the patterns that you're really aiming for. So that's really difficult, and therefore you also see still a lot of different mistakes, and you really need to be there as a human in the loop to really understand what the models are doing. Then the final challenge or risk is with regard to bias, is that you can also introduce bias. And this is an example I wanted to mention. It's a very old example, has nothing to do with AI, but just to understand how it's being done. This was a bridge, and the bridge needed to prevent access to the beach by it was a Parkway Bridge. I think it was close to New York, and it was many years ago. And Robert Moses was the architect. And as you see, it's quite of a low bridge, and that meant that the bridge was built in such a way that the cars could pass through, but the buses couldn't. And back then, only the black community traveled by bus because they couldn't afford a car, and the white community, they could afford a car, so they could travel by their own car. So in fact, the bridge was built in such a way to prevent access to the black community by this bridge. So this is just to show that how you can really introduce certain bias in technology. And you can also do that with AI. And recently it happened in the Netherlands with the toeslagen affair, which has been a really awful thing. And there, what basically the people from the tax services did is that they classified people with multiple nationalities or ethnic backgrounds as having a higher chance of being a fraud, and they were even handled like that. So that was really awful. But you see again here, that's what we as humans do. So we train these models. We say that certain groups have an increased fraud chance. So that's really the problem of the human using the AI. The final risk is the transparency, especially these machine learning and deep learning tools. They are black boxes. We don't know what patterns the AI tool discovers, and based on what rules of information a certain result is being given. And of course, this raises a lot of questions. How can we control the result? How can we trust the information? How can we challenge it? We have a right to a second opinion or a right to appeal. And also it's very important to realize that these models, they look at correlation, they look at patterns. And that's of course something different from causality, what we're usually aiming for in science. Finally, I've looked at the opportunities and risk of challenge, and in a very fast final 5 minutes, I will briefly touch upon the last element. So that's the development of norms and principles and integrating these into AI design. With regard to formulating norms and principles, I think it's first of all always to think about what problem of challenge do I want to address? And could AI or any other technology be of help? Could I realize the same quality or better or more personalized approach with the same or less people? And do we want to use certain tools for that or not? What regulations and norms and principles do we need to take into consideration? Of course, we have legal norms like the AI Act, and in healthcare also the medical device regulation. But as you, I think, as a bioethics community know, that legal rules are not enough. As I mentioned already, this global index on responsible AI, they measure a lot of different thematic areas of responsible AI. So it's about different norms and values, different actors that play a role in that. We have a lot of different European guidelines on trustworthy AI, for example. There is this guideline on fundamental rights and impact assessment. We have this very large model that looks at principled AI. So there are a lot of different guidelines from an ethical, from a societal, and from a legal perspective that plays a role. So there are a lot of different norms and principles that needs to be included. And how can you translate these to practice? I would like to give 2 examples just for you to have an idea about how you can integrate values into the design. The first one is about the development of a chatbot, and that is a chatbot from Snapchat, so it's for children. And sorry, it's again in Dutch, but at first the chatbot, they could really answer. They have a question, and then it could say, okay, when do you would like to meet? This Saturday, what time shall we meet at 2:00? Fine. And then they thought, well, that's a little bit of strange because you can't physically meet, of course, with a chatbot, and they decided to change that. And now, when you as a child ask to the chatbot, shall we meet? Then the chatbot will answer, I'm sorry, I'm just a virtual friend. I can't meet you in person. I think this is a really good example that people are clear on what they are engaging with. And the other example is from ChatGPT. So I think that's also a good example. In one of the prior versions, when you would ask ChatGPT, how can I kill the most people with only $1? They would just give you a list of possible answers. Because for this model, it's just the same question as how much candies can I buy for $1? It doesn't have any morality at all. So it's just answering any questions they will give. And also here they thought, well, that's not really what we would like to have. So now when you are asking a question like this, they will ChatGPT will give an answer. I'm sorry, but I cannot provide this information. So again, that's something that we as humans need to do. We need to program this into the chatbots. And I think, as you know already, I won't have time to go into that, but there is, of course, no single truth in ethics by design. What is a good thing to do? It's really difficult. If you're interested in that, and this, I think this courtroom algorithm gave, you can find it online if you're Googling. It's developed, I thought, by MIT. It's really nice, and you can see how different concepts of fairness influence certain results. So I think it's really interesting. Finally, I didn't talk to you a lot about these ELSA labs, but they are being set up in the Netherlands. They are big consortia with research, government, business, and public partners. We try to stimulate responsible development and implementation of AI. We do that by investigating chances, but also risks and challenges of AI, by developing theoretical approaches and frameworks, and also trying to help in translating these norms and principles to practice. So I'm leader of the ELSA Lab Northern Netherlands. If you want to know more about it, you can look at our website. We focus on different use cases in healthcare, and we do that from a multidisciplinary lens and pay a lot of attention to patient and public participation and dissemination. And finally, I would like to round off by asking you, what role will you play when we talk about responsible development and implementation of AI? Because as I hopefully also mentioned a little bit throughout my presentation, I think that the value of AI is not in the technology itself, but in how people will deploy the technology. And I think a really nice quote from Joseph Weinbaum, the inventor of the first chatbot, is that the greatest danger in modern technology isn't that machines will begin to think like people, but that people will begin to think like machines. So responsibly development and implementation of AI does not happen automatically, but depends on you. Thank you for your attention. And if there are any questions, I'm more than happy to answer them.
Thank you so much for that very nice presentation. It was very insightful. I'm not sure if there's anyone already with a question. Please feel free to ask or to raise your hand. Pascal.
Thank you very much, Mirjam. I would like to know how you see the role of ethics committees in these developments. So we, on the one hand, we see more and more ethics committees being confronted with projects where you have artificial intelligence or machine learning tools. I think I mean, the confusion is definitely there. How do you see the roles of these committees in this development? What do they need to look at? What is their role in the evaluation? Should they change can they have an impact on some of the concerns that you raised?
Yes, interesting question, Pascal. Of course, you have a lot of different ethical committees. I think one of the projects, at least what we're in the Netherlands are focusing on, is also the role that they can have within certain organizations, for example, because there very often you see also with AI compliance that from a legal perspective, there is this, committee, or there is something in place that you really have to comply to, legal, laws or regulations. Well, with regard to ethics, it's very often, it's just more advisory, and it's just a very different role. So there is also, some development in that you could say it's good to at least integrate that somehow in your development process or in your implementation strategy, that you say, okay, you have to comply to different standards, including certain ethical standards, and what they are, of course, that's another discussion. But to some extent, I think that's important that it's being taken seriously. So there's a lot of discussion on that. So also within you could say industrial companies, and also within, for example, our organization. So one of the things I'm trying to do with the ELSA Lab is trying to develop like, I don't know if it's the right word, but like a pipeline. Some organizations are building like innovations pipeline. So you have to go through a certain pipeline with new innovations, and then you have to, tick certain boxes. And then you want to make sure that that's, a lot of different things are addressed. Of course, the challenge is that it needs to be more than ticking boxes. You really want people to take certain aspects seriously, and that it's being done within the innovation team. So I think that boards and ethical committees certainly can play a role in setting certain standards, and a lot of these standards have already been set. But I think the challenge really at the moment is how can we make sure that these standards are being included or translated in practice, and that needs to be done by the development teams themselves. So I think it would be really good that if you have in an organization people who So one of the things that we're trying to do is to set up what we call moral literacy educational program, so that both the developers but also the users of the tools, they try to develop some form of literacy. And then I think that needs to start with that people know what questions they need to ask. But of course, all the answers can't be given. But at least you need to know, okay, what do I need to address? What do I need to know? What do I need to ask? And I think these ethical committees can help in setting a few standards, in helping out, advising these people, you could say, on the ground or in the development and implementation process on what questions they need to address in which contexts. And that needs to be contextualized, because it's, of course, you have general standards, but the use of AI in a different application area for different target groups, for different means, if it's diagnostic or prevention or screening or whatever, of course, that's really a different ballgame almost. So yeah, I think the really challenge is how can you go from this general standards to a more contextualized approach. I think that's really needed. And I think these committees can play a role, I think, in helping through this process. But it will not do on their own, I think.
Thanks.
Other questions? Please raise your hand or speak up if you have a question. No? I might have a question. I was wondering, because I know you have been engaging also with many different stakeholders. I know AI is already being implemented in healthcare, but how fast do you think it's going to go in the next coming years? Because there are like studies that now claim that like AI can outperform even healthcare professionals, but this weekend I read somewhere that the science, like the data behind these claims is not always there. But I'm just wondering, because if you engage with stakeholders, how much do they have the intention to use this, or do you also feel a little bit people being more careful, like saying, okay, should we use this? Are there like questions being raised if you talk to people about like the implementation of AI in healthcare?
Yeah, so I don't have all the answers yet, but there is indeed, if you look at healthcare, I think at least what you see in the Netherlands is that there is a lot of research being done, but actually the clinical implementation is really not that high. So I think at the UMCG, the examples that I give, then I think we are furthest probably with the use of generative AI in the electronic patient dossier. So that's also a form of AI which does not need to comply with the medical device regulation, because it's really used in an administrative way. If you see that the development of AI, which needs to comply to the medical device regulation, and that means that you use it in diagnostics purposes, for example, or treatment purposes, that is still quite limited. Also because you have to go through these different legal settings. What I think is really interesting in what you see is that because there is now regulation coming in place, but there is no general regulatory framework at the moment, like that we, for example, have with medicine regulation. That's really strong and very lengthy process. But if it's gone through that process, then it will be used everywhere, and everyone trusts the technology. That's not the case with AI. If we in the UMCG are developing a certain algorithm and we validate it in our own hospital, then it needs to be validated somewhere else, because there you have different data, different target groups, and also because we have done it in our way, then it will not be used in a different hospital because it's not trusted. As I said, it's different data. It also will need go through all these regulatory steps before it's even allowed also to use it in different hospitals. So there are a lot of different hurdles in that sense. So also what you said, AI is able to outperform. You see a few research results who find that, but that's then really specific for a certain AI which was compared in a really specific setting to a certain group, which doesn't really mean that in all cases it's always the case. And what we do know is that AI can do things faster. I think that's for sure. So that's also really the advantage. But better, and that's of course in the context of healthcare, you want to be that it's being done or equally good or better. But that's really a challenge, and especially a challenge for the more difficult findings. So, for example, when you look at this lung cancer, so then how do you say that? The more mainstream factors, which are also detected very well by the doctors themselves, they can be found also easily by these AI machines. But the more difficult ones, that's really a challenge. And I think what's going to be a challenge also for the use of AI in healthcare is also the false positive results. Because what these models do, they look at different patterns and they will find much more patterns than the doctors do, but also a lot of patterns that are not clinically relevant. So in that sense, I think that's going to be a challenge as well. And I think that's also what you see. So there will not be so many false negatives, I think, because but false positive, that's really is an issue. And I think a lot of you also have a lot of experience in that field with screening, and so the problem of false positives. And I think that's also something that will happen in AI research and in AI implementation. Yeah.
Okay. Thank you. Other questions?
I had 2 questions. So the first one is about biases that you talked about during the lecture. So AI and biases. So my question is, first of all, you said that these technologies can have biases because that these biases are also present within the medical field in terms of in general. So it's not only related to AI. So my question is, how would you address or make the implementation of AI responsible in this regard, especially if we think that maybe such AI technologies will be probably taken up mostly by the global north, which means that such technologies are then further trained on such data and might increase the disparity with the global south and the access of resources and the healthcare that these countries have. This is the first question. I don't know if I should go to the second or I can wait and then I say it after.
Maybe shall I try to start? So I think there, on the one hand, it might be an opportunity because we already know that we have these biases and we have this difference in data. And the fact that you use AI, it means that it's becoming, how do you say that? More prevalent or more visible. And therefore also I think it can help us to address this issue. From a technical perspective, what you see is that, synthetic data, so you could say even indeed these large language models, they can also be used to create synthetic or artificial data, and that can be used to mitigate these biases. So that's what we're trying to work on. If you have less data from certain groups, you can synthetically create that, so artificially create these data. The challenge is there that if you have not so much data, then it's really difficult to create a good model or to create good scientific data. So again, there the availability or the lack of the availability of the data, which is the cause for the bias, is also a problem for the development of this data, but they are working on that a lot, and that could be helpful. Still, then you would see that over time, of course, there will be, in certain groups more synthetic data generated than in other groups. You can also wonder what that would mean in the long run. But with regards to the difference between the north, the north and the global south, as with many things, you see, it's a problematic. This is really AI is. It can offer a lot of opportunities, but it costs also a lot of money to development, a lot of innovation money, which of course is more available in the global north, you could say. So yeah, I don't know what that would mean, to be honest. It offers some opportunities, but also a lot of risks and chances. Yeah, so I don't know. Yeah.
Yeah.
But it's really an important thing to address for sure. Yeah.
Yeah. And so thank you for the answer. And the second question is more about the physician-patient relationship and how we can be responsible in that regards, let's say. So maybe when we develop technologies, we can involve, for instance, different types of actors, because different types of actors have different knowledge. So for example, you can have scientific knowledge or you can have expert knowledge, which is the knowledge of the healthcare professional. But my question is more in terms of experiential knowledge, so the knowledge that the patients would bring in terms of their experience with an illness, and how can that be taken into account in AI or in responsible development? Because obviously I think that's something which is maybe hard to keep into account, the individual experiences with an illness and how these machines are used or trained to do so. I don't know if my question was clear. I hope it was.
Yeah, it is clear. Yeah, and I think that's also a challenge. So what data will be indeed used in these models? I think, of course, you could also measure that and ask for also among patients for these data. But of course, there again is a danger that there will be much more focus on more clinical data in that sense, in less of experiential or data from doctors and patients. So one of the models that we are looking at, that's a model that has looked, is used now in the intensive care, really for decision making for patients with a very, how do you say it, a serious illness, where they have to decide, am I going to offer treatment or not? So is there even a chance that this child will have a good quality of life? And what you now see is that these factors or these decisions are made on very implicit factors. So these models could help to make it more explicit. And they try to develop these models together with both patient groups, so parents in this case, and doctors. So we're going to investigate also, that's one of our researchers, to investigate what values indeed also the doctors have, and to what extent these values are taken into consideration or built into these models, and how do they evaluate themselves the use of such a model. So it's really difficult, I think, to say now how this will result in like 10 or 20 years. The technology goes fast, but I think what is extremely important is that in the development, and that's what I try to say with this human in the loop, that you have to develop these models together with the experts. So when you think about healthcare, both the professionals and also the patients, and the knowledge that is important for their treatment, the knowledge that's important for their diagnosis, and to what extent can you build that data or that knowledge into the system? Because if you don't do that, we're going to build models that use data that is there, that is accessible, but not necessarily the data that really is a data that is of importance. And then in the end, I think it will not really help us, but just move away from good healthcare. And that's really, I think, a danger. But that also depends, I think, on all of us being there and being involved, both professionals and patients.
Yes, thank you. Do you guys have other questions? No?
No. Thank you, Julia. Okay, if there are no other remaining questions, I would like to take the opportunity once again, Mirjam, to thank you very much for giving this nice presentation. I think we learned a lot. And if anyone has a question, I think you can still reach Mirjam afterwards. Do take a look at their website because it's very interesting work they're doing with their ELSA lab. Thank you all for joining, and the next seminar will take place in a month in November and will be by Dr. Andrew Barnhart on disabling digital twins. So thank you so much, and hope to see you all next time also. Thank you.